Hi, my name is Dr. Wayne Starin, and my purpose in family care chiropractic is to help as many people as possible to get well without the use of drugs and without the use of surgeries. But not only that, to educate our patients so they can in turn educate other people. A common question that people have asked me is, well, why are you a chiropractor? What caused you to be a chiropractor, or how'd you get into it? Well, it's kind of a long story, and I'll try to make it as short as possible, but when I was 18 years old, I was involved in a motorcycle accident. Went around a corner too fast, hit some water, ended up skidding out and hit my head on a tree and fractured my neck. So at that point, I was in the hospital for 2 weeks, and the orthopedic surgeon said I would be on muscle relaxers, pain pills, and anti-inflammatories off and on for the rest of my life. I would have early arthritis, chronic pain. I would never be able to work out again. At the time, I was playing football and bodybuilding, and to me, that just wasn't an option. And life as I knew it was pretty much over, just because the fact is I was in so much pain. So I asked my surgeon, what about going to a chiropractor? And he says, well, whatever you do, do not go see a chiropractor. So luckily I did, because initially when I went in, I had this big neck brace on. And I talked to the chiropractor that I used for football injuries in the past, and this was the extent of my range of motion, about right here. I said, can you help me? He says, well, let's do an exam and find out. So we did. And he comes back and he explained to me that there were areas where the vertebrae were out of alignment, and if we didn't fix those, then my orthopedic would be correct, and that I would have chronic pain and arthritis and things of that nature. So as I went through treatment, first month went by, we did a re-exam, and the extent of my range of motion was about here. And at the point, I was a little discouraged. So I asked my doctor, my chiropractor, I said, is this all we can expect? Because the pain had subsided a little bit. But he says, no. He says, I'm seeing some good objective changes, and I think we need to continue. So we did, and another month goes by, and my range of motion's improved to about here. And the pain has subsided significantly. So by that point, long story short, 6 months into treatment, one day I walked into my chiropractor's office, and I said, hey, Dr. Hamby, check this out. I had full range of motion, no pain at all, and I explained to him that I needed to take him to lunch. And at the time, he was like, no, that's fine, because I'm glad I was able to help you. This is why I do what I do. And so I said, no, you don't understand. I need to take you to lunch. There's some serious things I need to talk to you about. So I took him to lunch, and I explained to him that, life as I knew it was over. The chronic pain, the loss of mobility, not being able to exercise, that's serious stuff for me. So, I had actually gained my life back, and I needed to know how to do what he did. At the time, I only knew that chiropractic could help things like, neck pain. So at that time, I went to chiropractic school, went to Palmer College in Davenport, Iowa, originally from California. So I only went there for the school. It's the largest and most prestigious chiropractic college in the world. It's actually where chiropractic was originated. So since then, since I graduated, I've noticed that people have been indoctrinated to believe that you really need to take a pill for every little symptom. And to me, that's ridiculous. Okay, so in other words, if you get headaches, a common question is, well, what do you take for that? Well, I take ibuprofen or Tylenol or something like that, aspirin. Okay, well, if you get digestive problems, what do you take for that? Pepcid, Tums, if you get allergies, what do you take for that? Allegra, Claritin. If you get pain, just normal pain, what do you take for that? Anything from ibuprofen to Tylenol to extra strength Tylenol. So really, I think the main focus is we really need to find out what the cause of the problem is and work on fixing the cause. And that's exactly why I've created a wellness center where we have anything from physical therapy, chiropractic, acupuncture, detoxification, adrenal testing, massage therapy, deep massage therapy, to get in and work on trigger points, doing myofascial release, trying to break up scar tissue as well, decompression therapy. So we do a lot of things here. A lot of times we're able to get people well when they've gone other places and not been successful. So I hope you come to see us. If you want to get healthy, then I definitely think it's worth a chance to find out if we can help you. Thank you very much.